Assalamu alaikum. My name is Sanali, and our topic is hepatitis C. So let's start. Hepatitis C is a liver disease caused by the hepatitis C virus. It is most common blood-borne viral infection. Many people with the infection do not know that they have it. The hepatitis C virus causes hepatitis C. It is a contagious, and a person can transmit it to someone else through blood-to-blood contact. Generally speaking, hepatitis refers to an inflammation of liver, and the hepatitis C is one of most contagious form or type. So these viruses invade liver cells, causing swelling and dysfunction. Over time, inflammation in the liver tissue can damage the organ. Hepatitis C infections can be acute, means short term, or a chronic, means long lasting. When a person has acute hepatitis, symptoms can last for 6 months. Firstly, let's discuss acute hepatitis C. It lasts from 2 to 12 weeks. The symptoms are fever, fatigue, abdominal pain, loss of appetite, and nausea or vomiting. Dark urine, clay colored stool, jaundice, but it rarely occurs, and joint pain as well. In case of chronic hepatitis C, it becomes chronic when the body cannot clear the virus. In the most cases, chronic hepatitis does not cause any symptom or cause general symptoms such as chronic fatigue or depression. And a person may only find out that they have the condition during a routine blood test or a screening for a blood donation. If the symptoms of the hepatitis do not treated properly, it can cause condition cirrhosis. Cirrhosis is a condition that is characterized by scarring of the liver due to the continuous long-term liver damages, either by a disease or excessive alcohol consumption or another cause. So scarred tissues replace healthy tissues in the liver and prevents it from functioning properly. The damage caused by cirrhosis cannot be reversed and can eventually become so extensive to a stage where liver stops functioning. So, let's get back to the hepatitis C, as it can cause by receiving transfusion or organ transplant or exposure to a needle stick, which is most common in people who works in healthcare, and being born to a mother who has hepatitis C. So a diagnosis and the test can be done in the laboratory to know if a person have hepatitis C. A doctor will perform different tests, but firstly, simple blood test to look for the hepatitis C antibodies in the blood. If the test is positive, means that the person has had exposure to the virus, but does not necessarily prove ongoing infection. On the second term, physician will perform a blood test called hepatitis C RNA test. This will check by whether the virus is still present in the blood. On the third term, the test known as a genotype test can work out which type of hepatitis C virus is present as. So let's talk about the treatment. As we know that the vaccination for the hepatitis C is still not available, but the modern treatment can cure hepatitis C in most cases. Moreover, it can be prevented by taking a proper diet. So diet has a major concern in hepatitis C. There is a specific diet to follow if you have hepatitis C, but eating healthy food and cutting out food that lack a lot of nutritional values is often a good place to start. It is important to maintain your weight. So in the fruit and vegetable categories, one should eat 1 or 3 cups of vegetable each day in order to get the widest range of vitamins. On the second approach, foods containing proteins are very important. Proteins helps repair and replace liver cells damages by hepatitis C. So great protein options include fish, seafood, chicken, nuts, eggs, and so. On the other hand, dairy products and the whole grains are best as well. Whole grains like brown or white rice, whole oats, and whole grain products like refined varieties like fiber, vitamin B, zinc, magnesium, iron, etc. So, and then let's talk about the food that we should avoid while we have hepatitis C. In general, you should limit food that are fatty, greasy, or processed food, frozen or canned as well from fast food chain. Food should avoid. And on the other hand, reduce your salt intake. Cutting out dishes that are high in sodium is very important because salty food can lead to water retention and consequently raising your blood pressure and many more. So the sugar intake can also be reduced because sugary treats when eaten in excess can lead to a weight gain, and the weight gain can lead to a diabetes risk. So to help stay on the right track, you should avoid the sugar intakes as well, and fruits can be an excellent choice when we will talk about the sugar intake. So thank you so very much.